kapag may karamdaman. Naghahanap tayo ng karamay. Lunas sa sakit ang inaantay. Sa nakalipas na 100 taon, isang ospital ng bayan ang patuloy mong maaasahan. Ospital na hinubog ng mga dakilang nilalang na nagsumikap na ito ay umunlad para masagot ang pangangailangan ng komunidad. Isang ospital na patuloy na nagbabago upang maghatid ng serbisyong pangkalusugan para sa inyo. Sa susunod na 100, sama-sama tayo na magtulungan upang magbunga pa ang ating nasimulan tungo sa malusog na bayan at mas makulay na kinabukasan.
The SPMC's IPBM's history is tied up with the earliest beginnings of Southern Philippines Medical Center. By order of the Department of Health in 1958, the Davao Regional and Medical Center was relocated and established at its present compound in J.P. Laurel Avenue, Bajada, Davao City. The old Davao General Hospital, built in 1918, was then transformed into a hospital ward. The Davao Mental Hospital was originally the Davao Public Hospital in 1919. It then later evolved into the Davao General Hospital. However, it wasn't until 1957 by the Republic Act No. 1859 that it was converted to the Davao Regional Medical and Training Center, which is currently the site of Southern Philippines Medical Center. In 1982, the Davao Regional Medical and Training Center, DRMTC, was officially renamed the Davao Medical Center, DMC, which was later renamed to the Southern Philippines Medical Center, SPMC, in 2019. When the Davao Regional Medical and Training Center was established in the current site of SPMC, the building that was vacated became the Davao Mental Hospital. Administratively, it was an extension unit of the National Mental Hospital, and it was later placed under the Davao Regional Hospital in Tagum. In 1986, Dr. Alfredo Bengzon, the then Secretary of the Department of Health, appropriated a special trust fund for the rehabilitation of the Davao Mental Hospital. Later on in 1992, Dr. Juan Flavier, the new Secretary of the Department of Health, supported further changes by advocating a thrust towards a foundation of improved competence for better healthcare delivery in the health system. The Davao Mental Hospital was placed under the administrative care of the then Davao Medical Center, Dr. Asuncion Paraan as DMC Chief of Hospital, and Dr. Laureen San Agustin Conanan as Chairman of the department, initiated the rehabilitation of mental health care needs of Davao Mental Hospital. While DMH functioned as separate hospital, the administrative personnel were under Davao Medical Center and were identified as DMC Department of Psychiatry. Addressing the global need to address mental health and the rapid developments in technology and neurosciences, the institution yearned to make Davao Mental Hospital as the leading mental health center in Mindanao. And by 2006, Davao Mental Hospital started working with professional groups of local city-based architects and engineers of various fields. The transformation of Davao Medical Center into Southern Philippines Medical Center has also enabled the Davao Mental Hospital to deliberate ways of fulfilling an integrated regional mental health plan and program, achieving its goals and renaming it into the Brainchild Institute of Psychiatry and Behavioral Medicine. Its residency training program in psychiatry was first accredited in 1994, uniquely being the first medical institution of its kind outside of Metro Manila. This department caters to various nursing and medical schools in Mindanao for related experience in psychiatry. The outpatient services of the department are conducted within the hospital premises. Areas are provided for the following: interview rooms for the resident physicians and clinical interns and clerks on rotation, patients waiting area, treatment area for nursing personnel, social services, psychological service, pharmacy, record, and billing service. In the Crisis Intervention Unit, CIU, all new admissions and readmissions are coursed through this unit. They are admitted without relatives who are required to fetch their patients once ready for discharge. The admissions are also isolated and swabbed to ensure safety prior to placing in the general ward of the CIU. A total of maximum stay of 14 days is allowed. Acute ward. Here, the patients who are not showing any improvement at CIU and for those who need further diagnostic workup or therapeutic intervention are transferred to this ward. A maximum stay of 8 weeks is allowed. Chronic wards. For patients who are still not improving at the acute ward, patients who cannot be sent home despite of an improvement, and patients who are institutionalized are placed in this ward. Patients with medical surgical problems who need further evaluation or management are seen as the main hospital unit of SPMC. They are either sent back with instructions or follow up or admitted to the respective clinical departments as they see fit. As of September 2021, SPMC IPBM is a 300-bed capacity institution with the following allocation: 50 beds for the Crisis Intervention Unit, 100 beds for the female ward, 150 beds for the male ward, and by 2022, the proposed 2-story emergency room Crisis Intervention Unit will begin its construction. The occupational therapy section is actively involved in the structured activities of the male and female wards and has several ongoing livelihood projects in which the patients are involved. With the proliferation of nursing schools currently rotating for psychiatric nursing, activities which complement those of the OT service are engaged in. The social service is actively involved in discharge planning, home visitations, and home conduction. An ambulance is available for exclusive use of the department and is used for these purposes. SPMC has laboratory facilities for routine and blood chemistry examinations. Public health aspects of laboratory like water analysis, food and drug analysis, and special laboratory exams like hepatitis and HIV testing, culture of acid-fast bacilli and mercury, and cholinesterase level determination are available. Histopathology and biopsy examinations are also done. There is an X-ray and cobalt therapy unit. Ultrasound facilities have also been made available. Lithium determination is available SPMC IPBM laboratory and in private laboratories within the vicinity of the compound. CT scan machines and MRI are available at the main building of SPMC. Consultants in the departments trained in neurology reads the EEG. An ECT machine is newly purchased with built-in ECG and EEG. SPMC has an industrial laboratory that is accredited to do drug testing for substances like methamphetamine and cannabinoid. Accreditation teams have granted the following accreditations to the program thus far. During the first 3 to 5 years, there was a transition of the residents from non-training to training status. Their training needs and requirements took into consideration their previous years of experience and service. Concomitantly, there was a fast pace of development as well as in the field of neurosciences. Updates on biological psychiatry, its related fields, and the newer areas of the study related to behavioral disorders were continually visited, as it was establishing the basic elements of a competent and relevant program. Besides the clinical work with patients, the department organizes teams in stress management, both in the workplace and in the community setting. The residents in training are actively involved in these endeavors. They have been actively participating in disaster management. Mental health and psychosocial support was done during several disasters: 2 airplane crashes, flood, bombings, the previous Mindanao massacre, victims of Typhoon Sendong and Yolanda, and the recent Rojas bombing and Marawi siege, earthquake in Magsaysay in 2019, and during the ongoing pandemic. Residents participate in the outreach program and visit courts and jails to facilitate mental health needs and assessments of this population. All these have helped to advocate for mental health and provide residents with a more realistic view of mental health situation in Mindanao. Since IPBM is the biggest government psychiatric facility in Mindanao, it caters to the psychiatric training needs of the medical interns and clerks and nursing students from 31 nursing schools in Mindanao. This has presented itself with the opportunity for residents in training to teach students. Family medicine's rotators enhance their own training with the opportunity to work closely with peers on both medical and psychiatric cases. Currently, the residency training program has 11 residents in training. Four third years, 5 in second year, and 2 first years. It has also produced 32 graduates. Majority of these graduates are currently diplomates and fellows of the Philippine Psychiatric Association. Notably, it has produced several top-notchers in the diplomate examination given by the Specialty Board of the Philippine Psychiatry. Several graduates also underwent subspecialty training, 2 in child and adolescent psychiatry, 2 in consultation liaison psychiatry, and 1 in addiction psychiatry. Currently, 1 graduate is undergoing fellowship training in consultation liaison psychiatry. As for research, several has been completed by the graduates and contributed to the pool of mental health research not only for Mindanao but also for the entire Philippines. Award and recognition in both inter- and intra-hospital competitions have also been gained by the graduates of SPMC IPBM. As such, SPMC IPBM continues to strive for excellence and produce capable mental health professionals worthy of providing the best care and furthering the advance of holistic approach to mental health. For there is no health without mental health.